Several clinics have been swamped with queries on the Sinovac vaccine before registration starts tomorrow. 24 private clinics have been licensed to provide the vaccine. Some of them told CNA they have received hundreds of queries since this morning. Nia Rongwei reports.
A snaking queue outside this clinic in Clementi, just to register for the Sinovac vaccine. At least 1,000 names have been left at the counter, and the list is growing.
It's overwhelming. Lots of people very interested. Some patients, unfortunately, couldn't get through on the phone, and had to personally come down. And there was a long queue outside of the clinic, which I really wasn't expecting.
The clinic is offering each dose at $10, the lowest price of all 24 selected providers. But those who are unable to take the Pfizer and Moderna vaccines for medical reasons will be able to get Sinovac for free. The clinic is hoping the vaccines will arrive on Friday so that it can roll out vaccinations over the weekend. Another clinic at Farrer Park has around 450 registrations for the Sinovac vaccine. This is on top of numerous queries made over the phone. It's expecting some 200 doses to arrive on Friday and plans to start vaccinations from next week.
I think there's just been a lot of pent-up demand for the third vaccine in Singapore, right? People have been well aware of Pfizer and Moderna options that are available, but they've also seen news where there are some reports of adverse events associated with these mRNA-based vaccines. So I think a lot of patients who are more conservative, who are concerned about newer technology may want to default to something they're more familiar with.
Sinovac has been made available under the special access route to widen vaccination coverage. It will help to inoculate some 34,000 people who are unable to take the Pfizer and Moderna vaccines. However, those who experience serious side effects after taking the Sinovac vaccine will not be given financial help. They are advised to discuss the risks and benefits with doctors. Dr. Sell says it's important that people get all the information before making a decision.
And sometimes there are many various other influences behind them. Family, for one, is a big one. It's always very important to find out what the patient's thoughts are, what their views are, what they've heard from other people. The patient has to make sure that they've made the best informed choice with the information that they have and that they're happy to proceed.
Meanwhile, some private healthcare groups had applied to offer the Sinovac vaccine to patients, but didn't make the list. Among them, the country's largest private healthcare provider, IHH Healthcare. The group told CNA it had hoped to offer Sinovac at its facilities, but was not selected by the ministry. It operates 4 private hospitals and has a network of over 40 clinics.